So, um, what we want to talk about here is just a little bit of a primer about regenerative medicine. Now, this stuff is new. It is coming down the pipeline. Um, really new as this has been used for decades, but um, adult stem cell therapy in particular is very new, being used in clinics and really being used out there where we're seeing a lot of good results. When it comes in terms of medicine, this stuff is fairly new, still considered experimental by insurance. So the regenerative medicine stuff, this stuff is not covered by insurance. That should be known off the bat. But it is very promising and showing very good results in a lot of people, and we use this a lot in our clinic. And hopefully we'll be seeing this more and more as the medicine catches up with us. So platelet-rich plasma, this is a general term for we draw blood out of an individual. So an individual's own blood, what we do is we isolate out of their blood the healing portion. So the portion of the blood that if you cut yourself or if you sprain a joint, something like this, this is the part of the blood that gets there. It causes some inflammation first and then starts the healing cascade. We take that part out of the blood, isolate it down, and then re-inject it into areas where we want specific healing to happen. This tends to be in areas where we don't see a lot of blood flow. Tendons, ligaments don't get a lot of blood flow. These are areas that are particularly, I find, are particularly useful with PRP in regrowing and building this type of soft tissue. But we can also use it inside the joint to aid with some healing in that areas as well. Adult stem cells. These are cells, again, in brief, that are used by the body. So usually when we hear about stem cells, we're in the news or things like that, we're hearing from people that are using cells externally and bringing them in. But you need to know that there are stem cells all throughout your body. These are the cells that your body uses to heal itself. If you cut yourself and you grow new tissue, new skin, whatever it is stem cells in your body that is causing that healing. Most of them are stored. The cells that your body uses for healing are stored in your bone marrow. So inside your bones, that is where you grow and you create new stem cells. And then when you have an injury and you need to see some healing, these come out, they go to the area, they turn into whatever tissue they need to turn into to heal, and then they create a repair response. Again, most people don't get it through their head. These are currently in your body and you use them to heal. So what I want to just go through briefly, again, this is a very complicated topic, but I think the easier way to think about it is, so when you normally heal, so first you have an injury. This is you with an injury, which poor guy had a couple injuries, but you have an injury, and so the way your body normally heals is platelets come to that area, they aggregate, they grab onto each other, and then they start spitting out a bunch of these little things, which are growth factors. Well, the growth factors do a couple of things. They start the healing cascade, which inflammation, good acute, or what we call acute, good inflammation, which is the result of an injury, is a good thing. It's the first step in the healing process. It is your body ramping up a response that it's going to heal, which this is crucial to have this inflammation as the first step of the process. So that's why we don't want to use any type of NSAIDs. Motrin, ibuprofen, Advil, all the same thing. Naproxen is Aleve. Celebrex, Mobic, Voltaren, these type of things, anything that is an NSAID, NSAID, is an anti-inflammatory. It's a non-steroidal anti-inflammatory, but we also don't want steroids. Anything that is going to stop this inflammation process is also going to stop a lot of this healing. So we want to see the inflammation. We want to get this healing process started. So that is part of what a lot of these growth factors do, is they start the healing process. Some of these growth factors, chemical signals, also go into the bone marrow. And this is a pelvic bone. This is where we get stem cells from, but it's also where your body stores a large amount of its own stem cells, which, again, during the normal process, your body's stimulated to let these stem cells go out into the bloodstream. They float around until they find the area of injury, and then they get into the process and they start helping with the proliferation phase, laying down of new tissue, but also the remodeling phase of actually turning that tissue into good, healthful, healthy, useful tissue. And then once you get to the end of this remodeling process, which can take 60 days, 2 years, a lot of times we see about 6 months is a good, healthy time for a full process to go through the remodeling process. The individual is healthy and tissue is repaired. So in an assisted healing process, so that was the normal healing process, and an assisted healing process where we utilize regenerative medicine is to do a couple of things. So first, generally called PRP, protein or platelet-rich plasma, is we take out of the blood, we concentrate these things, we put them back into a certain area. So this may not be, there may not be an injury involved, there may be, but there may not be an injury involved. But if we're looking for some place that we want to heal, and that has not healed well from a previous injury or is not healing well as a chronic condition, we take the platelets, we put them together, and we basically cause this to happen, and that starts the rest of this cascade, and everything else happens after it. But we're using this, we use PRP to start that cascade. Another way we can assist that process is by using stem cells, to where we, same idea, we use the PRP, we go in, start the healing process, but then we can also go into the bone marrow and extract a large amount of these stem cells and put them back exactly where we want to heal, and assist the process, assist the body from doing what it would do naturally, but we're gonna help it out and give it a much more robust response. Now, as a Regenix provider, we don't just assist the body. We have the Regenix healing process, which really, instead of PRP, we call it SCP, mainly because what we do, as opposed to every other clinic where they have a machine where they draw the blood out, put the blood in a machine, and the machine spits out a product, we actually create ours by hand, which allows us to make a much, much higher concentrated PRP than anybody else, as well as doing some other things to it that I can't necessarily talk about. But because our product is so much stronger because of these things, we call it something different. We call it SCP. We also call our stem cell product, instead of stem cells, we call it Regenix SD procedure, mostly for the same to refer to a same day procedure. But because ours is so different, we have to call it something different to make sure that that's understood. And what we're able to do as Regenix guys, we can make a product that is much stronger than what you can find anywhere else. And so this robust response, either from the SCP or from the SD, will lead to a much greater healing response. Okay, so that is just a brief overview, but I do want to take a minute and at least acknowledge some of the other products out there that are called stem cells. Now, the biggest problem here is that there is not a definite term when people say stem cell therapy. So pretty much anybody, any Joe on the street can call what he does stem cell therapy. In fact, there are a couple clinics that essentially just do PRP, and because they're concentrating the blood and there is some stem cells in the blood, they say, well, they're doing stem cell therapy, and what they're actually doing is is nothing more than PRP, which is a good product, but a much lesser product than what we would refer to as stem cell therapy. But there's some other outfits out there as well, groups that sell various things. Again, the type that we do is bone marrow concentrate. So we are going, the cells that your body uses to heal itself are found in your bone marrow. And that's where we go to get them. Those are the cells that your body uses to heal, and so we utilize them to help your body heal better. Now there's a couple other groups out there. Adipose or fat grafting can also be changed into an SVF, but the fat grafting by itself came out a couple years ago, started getting real big because somebody found that there were stem cells also in the fat tissue of your body, not necessarily used to heal yourself, but they're out there to grow more fat tissue. But the idea was, well, we can take those and put those in an area of injury and get a robust response, and that really didn't quite pan out. So the fat grafting is falling out of favor, and what they're doing instead is something called SVF, which may have some potential in the future, but currently is not allowed by the FDA. They do not consider it safe. So anything using adipose tissue is something that should be avoided. But you'll still see these groups saying stem cell therapy. Other groups out there are labs that collect amniotic tissue and cord blood from babies, from unborn babies or in cord blood born babies, which have a different type of stem cell in there. What these labs do is they then package the product, do something to it. They used to freeze dry it so it became in like a powder. Now they do more of a flash freezing to it. So they freeze the tissue, put it in a little vial, and then any type of medical professional can order it and utilize it. They make a number of claims about this, and you see a lot of clinics selling this stuff as stem cell therapy. There is a group called the Stem Cell Institute of America, which is a marketing firm that generally markets to chiropractors, that is really popular in the United States. There's a lot of chiropractor offices that are offering particularly amniotic tissue and calling it stem cell therapy, which again, bottom line is the packaging, according to the FDA, is there is no live tissue in there. They are not live stem cells, but there is a lot of growth factor in there. So similar to what a PRP is, that is closer to what the amniotic cord blood product is what it's like. It's closer to a PRP product, but these outfits call it stem cell therapy so that they can charge stem cell prices. If anybody is charging more than $2,500, $3,000 for an amniotic product, then they are getting way too high, and they're just trying to act like their product is something better than it is. So in a previous part of the presentation, if we're looking at our treatment of the OA of osteoarthritis of the knee, again looking at the current medical algorithm, which utilizes steroids, perhaps some general physical therapy, and then late in the game maybe utilizing some viscosupplementation, generally a one-time shot before going to surgery. We're looking at the advanced preventive algorithm, something that's better. Again, physical therapy, a very specific physical therapy to address the particular biomechanics of the individual. Then utilizing PRP, or what we consider SCP, inside a good, healthy joint at that point to perpetuate the good tissue inside the joint. Again, these are things that should be caught early. And then moving on to viscosupplementation to help with the cushioning and lubricating of the joint and replacing the lost synovial fluid, and then bracing to balance out the pressures on the joint. And then when all of that, ultimately when all of that's failed and the joint is near the end of its life, steroids should be used to provide some pain relief until ultimately the final tool is used through surgery. What I really hope to see coming down the pipeline, or at some point in the future, I don't know how far off it's going to be, but ideally we get to a point in medicine where we are looking at the joint as a something that we can preserve and something that we can extend the life on, as opposed to the current medical algorithm, which not only waits until the joint is nearly dead before intervening, but actually speeds the process of degenerating the joint. We should get to an idea, a thought process in medicine where we want to not only prevent degeneration of the joint, but actually encourage regeneration of the joint. So again, early on, we want to see physical therapy to address biomechanical issues. We want to use PRP to help some healing of the joint earlier on. Once we start seeing some damage, then we should be engaging with the adult stem cell therapy to actually have some rebuilding and keeping the joint at a top line before it gets the damage that a increased amount of wear and tear can do to it. Utilizing viscosupplementation to continue the protection, and really viscosupplementation becomes a moot point if we get to a point where we can use the stem cell therapy as a real tool, but still something else to be used in the tool belt. Bracing to address any type of issues as the joint moves further and further through its lifespan, and then again ultimately leading to steroids or surgery if that is necessary. So this concludes the presentation. Again, a lot of these therapies are available paid for by insurance currently, but the regenerative ones, the ones in yellow, are not. Hopefully someday we will see them picked up, because these are very strong tools. And I had a patient come in recently and tell me, I heard you can do something that's going to obliterate surgery. Well, currently we're not obliterating surgery, but we are at very least pushing it off for a lot of people, and in some people making it such that they can avoid it altogether. But hopefully if we really get in the mindset that we can address some of these issues early, really that kind of preventive mindset that we're starting to see in medicine, if we can look at the joints in the same way and utilize the power of our bodies to heal itself, then I truly expect that these growing numbers of joint replacement surgeries that we're seeing are going to start to diminish rapidly as we find new ways to actually extend the life of our own joint and utilize our own potential to do that. So it's a very exciting area of medicine. Hopefully insurance will catch up soon, and we'll get to really kind of bask in the potential that we have here. But so hopefully throughout the series of these presentations, we're able to give you an idea of some of the therapies that are available, some of the potential of what's coming down the pipeline, and something that you can utilize if your goal
is to extend the life of your own joint or actually help to rebuild, come in here and we can talk about your specific situation and help you with that.